All right. We are going to learn. Hi, this is Mrs. Sager. I'm sorry. We're going to learn catheterization now, okay? So you're going to check your orders. You're going to do all of your wipes, and so you've explained to your patient that you're going to be doing a catheterization. Now, what we're going to do is we're going to learn how to catheterize a female anatomy at this point. And then we will learn how to do the males. So what we want to do is we obviously have to expose the lower half of a female. So we don't want to do this and just open her right up to everything. So you only want to have exposed what you need. So we've pulled the sheets down, and we have to assume the position for putting in a catheterization, which is what we call the lithotomy position, which is the legs bent and up and out so that it opens up the whole area for us, okay? And then once that's done, we're going to open up our Foley catheter tray. And this is a sterile procedure, guys, but you see I have clean gloves on, and that's okay for right now. We're going to take it out of our plastic. Now this will be our sterile field once we open it, remember? So we want to open it away from us, okay? Not touching this inside, right guys? So we want to keep that part, and that's okay if it does this, because we haven't contaminated anything yet, right? So we want to get that open, see? Okay, and as you see, I have now my sterile gloves in there. I will remove my clean gloves, not over my sterile field. I'm removing my clean gloves, and those are going in the garbage. Now I want to take my sterile gloves, and I'm going to put my sterile gloves on. I don't want to put that on my sterile field. I want to move it away from my sterile field. And you guys know how to put sterile gloves on. I'm not going to go into all of this. Put your sterile gloves on without contaminating them. Okay? Skill we learned last semester. Okay, my sterile gloves are on. Now I can touch my sterile field. This little piece of paper here is got a treated side. See the difference? See the difference between the sides? This is a waterproof barrier. So you want to put that against the bed. So you want to put this down like that, okay? You notice I didn't touch anything. I'm still sterile, right? If I was to do this with my hand, which I'm going to have to eventually, this hand then now becomes non-sterile, okay? So I cannot touch anything within this kit with this hand, okay? Because now I've touched her and it's not sterile anymore. Okay, so yes, I'm going to need a hand in order to open up the labias, in order to put the Foley catheter in. So one hand is going to become unsterile. But at this point, we're backing up. I'm still sterile with both hands, just so that I can show you how to continue with this procedure, okay? This is a kit with a drape. Some places require you to use the drape. Some do not. Basically, you just take the drape, and it provides privacy. You can put it over the patient like that, okay? In our kit, we have a urine specimen container, so that when we're catheterizing, we want to send a urine sample. We can actually obtain that through this container here. In the kit itself is what we call the chloride swab sticks. Some of them will have the sticks. Some of them will actually have a liquid with cotton balls in here. If it was the cotton balls, what you would do is just open up this like this, okay? And you would actually, and thank God it stayed on my sterile field, huh guys? If this was liquid, all you would do is just pour it onto the cotton balls, and that's what you would use to clean the area on your patient. This one comes with the actual sticks that look like this, that we're going to use to clean all of the area, okay? Now, what else do we have in this kit? We have, see, there's fluid in here. This is the fluid that we're going to use to inflate the balloon within the Foley catheter itself that stays inside of the bladder. And then this here is lubrication. We need to be able to lubricate the catheter as it's going into the person to cause less trauma, you know, make it a little bit more comfortable for them. So we're going to lubricate them. So what you do is you just take off the cap and you squirt it into your kit like that, okay? And this all is still sterile, right? I can still touch everything here. So what I'm going to do is I'm going to move this right here. On top of this blue pad, I'm going to move everything right here, okay? Then you have your catheter. This is still all clean. It's all sterile, guys. You could take your catheter out. Okay, I'm going to show you now that here is your valve that you're going to put this syringe on so that you can inflate the balloon on your catheter. So you just insert the syringe onto there. And if you watch down here, when I push the fluid in, a balloon should increase at the tip of the catheter. See that? And that's what actually holds the catheter inside of the bladder so that we don't push it out with peeing or just stress, okay? And then you're saying, well, if it's got that balloon in there, how does the urine come through? Well, if you look at the tip of it, you see there's holes. And that's where the urine is going to come through. And it actually goes through the balloon, that tube does. So this urine passes through the balloon, through this tubing, and then into the catheter itself, okay? But in order to put the catheter in the person, we can't have that balloon there. So we have to take that fluid out. And why did I check that balloon? Well, you would hate to go through this whole procedure and have a faulty balloon that does not either inflate or there's a leak in it. So we always check our balloon prior to putting the patient and ourselves through the catheterization, okay? So now what we want to do is we want to move this, and we can, right here, onto the bed. We're going to take this. This is still sterile, guys, okay? This is still sterile. I'm still sterile. And we're going to take this with the syringe to the port, and we're going to put this tip inside the lubricant in our kit. And so that this is now ready for when we need to put it in. Now, much like cleaning for the labia and the female genitalia, when we're doing perineal care, we have to make sure that we clean all of the areas within the labia to make sure that we do not have contamination of when we insert the Foley in there with germs. So we want to make it clean. So we're going to take our cleaning sticks or our cotton balls, whichever one is your kit has, and you're going to remember now this hand is not sterile. It's now dirty. Okay, I'm going to clean, and I'm going to clean from clean to. Excuse me. I'm going to clean from clean to dirty. I know, opposite of what we did before, okay? But I want to make sure that I'm getting everything. So I'm going to clean outside, okay, and put that down. I'm going to open up the major, and I'm going to clean, okay? Put that down. Grab my other last one, or the last cotton balls, and clean the minors. And that is all now clean. Okay, guys? And then with my sterile hand still, because this hasn't touched anything but sterile stuff, I'm going to grab my catheter. And I'm going to insert into the urinary meatus. Okay? The urinary meatus is your upper. The bottom is the vagina, yes? And then the further one is the anus. Okay, we got to remember our anatomy. We're going to try not to touch any of the labia with this tip, okay? So you want to make sure that you're opening it. You're going to tell the patient, I'm sorry, just breathe. It may be a little uncomfortable, it shouldn't be painful. And just push it in until you start getting urine back. Once you start getting urine back, give it just a little bit more, okay? You want to make sure that that balloon is inside of the bladder. And then you're going to instill the water into that balloon, okay? And then you're going to disconnect that, and it should not come out. See, it stopped. And that's how you catheterize a female genitalia. All right, remember I told you I was going to show you how to catheterize a male genitalia. Now we've done everything, opened up our kit, and we have it all set here ready to clean the urinary meatus on the gentleman, okay? So what you want to do is you want to grab a hold of the shaft and get that up so that you can actually see it. Again, use either your cotton balls or your sticks, whatever it is that you have, and you're going to clean the urinary meatus, again, from the outer to the inner, okay? 1, 2, and 3. Give it a good cleaning. Get off anything that you don't want going in, okay? Now some of you will say that this is actually an easier catheterization because there's only one hole you have to deal with. That is true, but also with males, especially as they age, you have a prostate that you learned about last semester that can actually close off that urinary flow, and it actually can close off the urinary tract. So sometimes catheterization on a male can be more difficult than a female. So what you want to do is grab a hold with your sterile hand again, the catheter with the lubrication, and you're going to insert it into the urinary tract, and you're going to push again. You want to push until you either A, hit resistance, and at that point you're just going to try to get it in there gently. If not, you don't want to cause any major trauma. Sometimes males cannot be catheterized because of that prostate problem. But let's just say that we have a young gentleman and we're able to catheterize very well. And we get the urine flow and it's flowing in. So we just push it in just a little extra to make sure that it's in the bladder. We're going to instill the fluid into that balloon again. Okay? We're going to disconnect that. And then it should not come out. And then voila, you have now catheterized male. Hey guys, I'm going to show you what we call a Texas catheter. This is used on males if we cannot pass a catheter through because of prostate problems or anatomy, or the patient just flatly refuses to be catheterized. This is not a sterile procedure because we're not invading the body, so this can be just clean gloves, and just try to, you know, have a clean environment. And basically what a Texas cath is, it looks just like a condom with a valve opening on it. And what you do is you just kind of put it over the shaft, and then you feed it up over the penis like this so that it would stay on. Some of the kits would have a Velcro piece, much like this, that you would, it'd be thinner, guys, that you would put around, and put it around the penis like this, and it would stay in place. It would try to hold that catheter on. Now you have to be careful. Don't go reaming it onto the penis, because what's going to happen is the head of the penis will fill up with blood, and you're basically this acts as a tourniquet, so don't do that, okay? We don't want that to happen. This is just to actually hold the catheter in place. Now, you say, okay, so the urine's going to come out. Well, that's where you get your urinary bag, okay? And you actually connect it on to the end of this, okay? And slide it on so it's tight. And then the urine will come out and collect into our bag. And so basically, it's an outer catheter. So that's it.